My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I have here with me Dr. Len Tao, and he is known as the Reputation Doctor. He's an amazing speaker. I've heard him speak at many dental conferences across the country. And one of the things he teaches a lot is how to build an online reputation and how to effectively market that reputation to get new patients. He's been named as one of Philadelphia's top dentists, and if you Google him, you're going to find some amazing things patients have said about him online, and that helps him a lot in not only getting patients but also employees, and he's going to talk about that a little bit. But the question of the hour or the minute is, how do we really handle bad reviews? And what do you suggest? If you get a bad review, obviously you're going to get one. What do you do?
So I'll state right in the beginning of this, I am far from perfect. I run a dental practice, and we have negative reviews, and I like to say I welcome them. I have about 1,700 positive reviews right now.
My goodness. But
I have about 90-something negative reviews, so I'm far from perfect. I like to say I'm a New Yorker. I live in Philadelphia now, and I bring that New York attitude to Philadelphia because I piss people off. And unfortunately, they write bad things about me online, and it is what it is, and I deal with it. But I'm far from perfect. So, you know, it is what it is, and life goes on. It hurts when you get it. I always like to say a bad review may spoil your breakfast, but don't let it spoil your lunch. That's kind of what I go in as.
Very nice.
You know, and I like to teach that if you get a bad review, you know, relax, take a deep breath for 20 minutes.
That's right.
and just don't be angry when you decide what to do with it, because if you're angry, it can ruin your life online. So I mean, look, we're all not immune to bad reviews. We all should be getting them because we're a business.
Right.
Okay.
Right.
So and I teach a class called "Oh My God, I Got a Bad Review. What do I do?" So I have a lot of experience in this space. So look, the best defense against a bad review is to get more positive reviews. Okay.
Very nice.
I mean, you want to overwhelm those negatives with positives. That's the most important thing you want to do. Okay. Simply that. Get more positives. If you get a bad, ask more positives. Because if you get a positive, you feel better, okay?
Right.
Because you can't please everyone.
Right.
I think the first thing you want to do is identify what the issue was. See if you can fix the issue internally, okay? I truly believe, as I told you off the camera, that I think there's a truth in every review that's bad. So see if you can fix it. Use it as constructive criticism.
Sure.
Number two is try to contact the patient offline first. So by phone, by email, do not respond publicly. Okay? So because a lot of times, and I show these examples in my seminars, I've fixed the problem for the patient and they've taken the review down.
Very nice.
So identify the problem, fix the problem, patients are happy, they take the review off. Okay?
You don't want to shame them publicly somehow, or make them feel guilty in public, because that might lead to some crazy emotions that you don't want.
Well, what happens if you respond to the review, what does the reviewer then get to do?
Respond back.
Re-respond.
Right.
And that's where you start a war of words online, and you get something that's this big, and it goes to this big.
That's right.
So I like to take it offline first,
Sure.
See if I can fix the problem. Then a lot of times they will change the review or take it down completely, and I show real-life examples of this. Okay?
Nice.
Then if you can't fix that problem, or you can't reach the patient,
right.
then you can, I always want to say, I'm sorry. Even if you're not, you always say you're sorry,
right.
And said, you know, I don't see you in our database. Please contact the office to discuss your concerns, or say, I'm sorry, you know, due to office policy, I can't discuss, you know, this. Again, you want to just say something very
you want to be compliant with HIPAA and all that stuff, right?
Right.
Yeah.
So, in regards to that, you know, one of the biggest questions I get is, you know, can I acknowledge that they're a patient? So, flat out, yes, you can acknowledge, because they brought up that they are a patient,
right.
But you can't divulge any personal information about the appointment.
Of
like
course.
You can't say your gums bled because you haven't been to the dentist in a year. That you can't say in a review response, but you can acknowledge they're a patient. That is not true that you cannot do that. So that's something that's really important. You can acknowledge that they're a patient. So yes, you want to be careful how you respond. You don't want to be angry. You don't want to shame them. You don't want to call them out. You want to call them dirty names. So be careful how you respond, but make it a nice, short, just so you acknowledge that you heard them. Tell them to contact you offline, and that's the best way to handle these negative reviews.
And is there some system that you look at? So like there's lots of review websites out there that help you with this stuff. How do they work?
They don't work.
Okay.
None of these companies, you can't pay a company to get reviews off. Negative reviews, like I said, the best defense against a negative review is simply to get more positive feedback from your patients. You don't want to sue a patient about a bad review. That will get you the worst things in the world. You'll get like shamed by the media. No suing patients, because I show examples of that as well. It makes the news. You don't want to make the news for that.
But one thing we talked about, and we can end the segment with that, is the review culture. You want to build within your organization a culture that focuses on giving the patient a great experience so that they will end up leaving that good review. And that's what I think you practice in your office, but that's what you teach as well.
Sure, and the reason why I do that, and I think we talked about this, was I just had I had an employee, had a position open up, and I had an employee or potential employee come to my office, and she mentioned to me that one of the reasons why she was so excited to come to my practice for a job interview was that I had all these great reviews, and she said that before she even goes for an interview, she looks at the reviews of the practice to see if she even wants to go for an interview, which was the first time I ever heard that before. So it's not just to attract patients, it's to attract potential employees to your practice.
And then bad reviews could potentially end up, turning somebody off who could be a great employee. So
right, and look, if you have bad reviews, people who are looking at you online don't call your office up and say, "Hey, guess what? I'm not coming because you suck online."
Right.
They don't even just come in. That's the difference.
Then that's an amazing story, and I think our audience is going to love hearing about strategies on how to handle bad reviews. So thank you so much.
Thanks, Mo.